So, Mr. Gwynn, when calculating proposals that would make significant changes to federal programs that provide families with access to things like affordable health care, child care subsidies, and nutrition assistance, it is important that we look at the context in which these proposals are being considered. And we should acknowledge that within the last year, Republicans have passed a law that reduced funding for Medicaid by nearly $1 trillion and for nutrition assistance by almost $190 billion. They also diverted funding that could have otherwise been used for public schools to create the first ever nationwide voucher system that basically just supports private schools. So at a cost of estimated about $500 billion in diverted taxpayer money. In addition, they have alleged widespread fraud in child care programs despite little evidence, but generally this kind of fraud only happens in blue states. So they are now alleging widespread fraud in Medicaid programs using inaccurate and cherry-picked numbers to justify additional cuts in, once again, blue states. And Republicans do not believe in the programs and will do whatever they can to undermine them. So we should be skeptical, as far as I'm concerned, of their motives in proposals like this. So, Mr. Gwynn, can you tell us how the one big beautiful bill, which I call the big ugly bill, and the failure to extend the ACA premium tax credits could worsen benefit cliffs for families? And in your view, would this failure to extend the ACA premium tax credits help families? That sounds like a rhetorical question. Go ahead.
Thank you for the question. As you mentioned, the cuts that we saw in Medicaid and ACA, largest in history, over $1 trillion in those programs. The legislation also, as you mentioned, failed to extend the expiring enhancements to the premium tax credits. And both of those are having significant effects and will have significant effects on people's access to affordable health coverage. Just one example, because of the expiration of the enhanced premium tax credits, the premiums people are now paying in the ACA marketplace are more than double on average than they were a year ago. So we've seen huge spikes because there's less assistance there for them to be able to pay those premiums. And as a result, people are either paying more or some people are dropping out. The numbers are still coming in, but we know people are losing coverage. And the Medicaid cuts are on a kind of rolling basis. We just saw a rule the other day related to the work requirements for Medicaid. But overall, the Congressional Budget Office estimated that when you look at the changes in Medicaid, the changes in the ACA, and the failure to extend the premium tax credit enhancements, 15 million people are going to lose coverage over time. So, yeah, it's a very dramatic effect.
So one of the suggestions is that all of these programs be combined into big block grants. Do you have any concerns or opinions as to how that is going to impact families who rely on these kinds of programs if they are block granted?
Yes, certainly. We were reviewing this a little earlier, but the history of block grants is not particularly a good one in terms of what happens to federal funding that goes to block grants. Over time, it declines in real terms, either because it's cut or because it's essentially left to wither on the vine, not increased for inflation, not increased for increased need. And so we see federal resources to block grants go down over time. We also see states using block grants for a wide variety of purposes, not necessarily connected to the core purpose of the block grant when it was originally established. And so the effect of these two outcomes is that ultimately you have less resources going to people in real need.
Well, obviously, with the federal government cutting back on the resources through either major cuts, like what happened with Medicare, Medicaid, is to block grant, and what that does is it's going to put the onus on local governments, state governments, to try and support their communities. And what's happening with the states? Do they have the kind of resources to fill in the gaps that will result in the federal government pulling back?
No, and we're seeing a real problem with this cost shift to states under SNAP. For the first time in history, states are going to have to pay significant dollars for SNAP benefits, and that's one of the reasons they're starting to cut back on eligibility in fear of those new provisions.
Well, I have other questions I can submit for the record. Thank you, Madam Chair.